Hey everyone, good morning. Welcome on into North Dakota today. June actually marks National Men's Health Month, and it's a great time for men to prioritize their own health by scheduling an appointment with their primary care provider and completing any of those screenings they may need. Joining us this morning with more information is Dr. Eric Jacobson with Essentia Health. Good morning.
Good morning.
How are you?
I'm doing well, thank you.
Yes, so happy you could be here because we've got a lot to go over. Is it true that when it comes to their health, men are less likely than women to seek any type of preventative care?
That is very true.
Okay, scary.
Yeah, one of the most common things that I hear from patients when they come in, first thing I ask, what brings you in today? What can I help you with? Well, my wife told me to come in, or my partner told me to come in. So yes, oftentimes men do need a little bit of a nudge to get in and take care of their health, but we just want to make everyone aware that we're here for you. We want you to be well, healthy, and happy, and there's a lot of things that we can do to ensure that.
Yeah, like shining a spotlight again on Men's National Health Month. So why are men likely to not seek preventative care as often as women?
Right, well, men are humans like the rest of us, so we all have a lot of the same fears, right? We're fearful for hearing something that we don't want to hear, fearful for receiving a bad diagnosis or things coming to light that we'd rather push away, ignore, things like that. But specific to men, I think there's a certain Midwest stoicism that a lot of our culture is very embedded with, that we have that strong, independent sense of ourselves. And we don't really want to be told what to do or suggested what to do from a healthcare provider or anyone else. So, what I want men to know is, your health it's not a directive, it's more of a conversation. And that's really the value of forming a relationship with a primary care provider, because we can talk about your goals, we can tailor your care to you yourself, and assuage a lot of those fears and insecurities that might be a barrier to a lot of men getting their own care.
So would that be the first step, maybe setting up a primary care
Absolutely,
provider? Okay.
yes, absolutely. Easy to do. There's plenty of primary care providers within Fargo. Essentia Health, we employ physicians, physician assistants, as well as nurse practitioners, all providing excellent means of primary care. So easy to do, easy to set up, not a painful experience in the least.
Okay, so let's talk about preventative care though.
Sure.
Why is that specifically very, very important?
Right, so when we're talking about preventative care, there's a wide breadth of aspects to that. So a lot of times when people think about screening tests, they think about cancer screenings, specific things like that. But really, when we're looking at preventative care, the second you walk into my exam room, we're starting to screen you for health issues and identify risk factors and areas with which we can improve to help your overall health, your overall happiness, and quality of life. So as soon as you sit down, we're taking your blood pressure. Right away, we start with cardiovascular screening. The nurse is going to ask you about tobacco use, going to ask you about alcohol use, identify any problematic patterns or risk areas that we can target to improve the likelihood for you to live longer and live happier. So there's a lot that goes into prevention. It's early detection. It's looking at family history, personal history, identifying those risk areas, and then applying our best practice to help you live your best life.
And so obviously testing is patient by patient. It's very specific to who you are. But what are just overall recommended screenings for men in general?
Right, so the number one cause of death in America for men, 1 in 4 men will die of cardiovascular disease. That includes things like heart attack, congestive heart failure, stroke. So as I mentioned, right away when you walk in, we're going to check your blood pressure, we're going to check your weight and your height, calculate your body mass index, identify certain risk areas which we can address and hopefully improve. Beyond that, there's conversations about, well, what lab tests are we going to run? For most patients above 40, we're going to get like a cholesterol panel or a lipid panel. Sometimes even younger patients, because there can be a large genetic component to your cholesterol metabolism, which puts you at higher risk even at a younger age. So identifying those areas and then moving on to successive testing, like having a heart tracing or an EKG or an echocardiogram if we hear something when we listen to your heart, going for calcium scoring CTs to identify the burden of coronary artery disease. All these things can catch things before they become a problem. It's the same reason we schedule regular maintenance for our vehicles, right? We don't want to break down in the middle of the road. So if we're taking care of our cars, we might as well take care of our bodies just as well.
Yeah, that's actually incredible. I'm glad you
Yeah.
brought that up. That's a nice way to
For
look
sure.
at it. Okay, so how do we find more information for possibly setting up a PCP with Essentia?
So essentiahealth.org, lots of useful information on there. You can call our general scheduling number, 701-364-8900. I give that out 20 times a day, so
Yep.
it's at the top of mind. And then if you've been to Essentia before, you can use the MyChart app and schedule appointments on there as well. So very happy to see you and get the ball rolling on living your best life.
Perfect. Thank you so much for joining us this morning.
You're very welcome.
Yeah, we appreciate the information. All right, coming up, we have your daily dose of motivation on North Dakota Today.